just wondered if your birth control pill is really the best possible fit for you? I mean, maybe you've heard people throw around terms like high dose or low dose and felt, a little lost. So what is the real difference, and does it actually matter? Well, let's break it down.
Here's how we're going to do it. First up, we'll explain what dose even means here. Then we'll get into the big one, effectiveness versus side effects. After that, we'll look at the overall pros and cons, point out who needs to be extra cautious, and wrap it all up with how you can find your perfect fit.
All right, section 1, dose explained. Let's get right to the bottom of what makes one pill high dose and another low dose. And spoiler alert, it really just comes down to one key ingredient. Okay, so we're talking about what are called combination pills. And as you might guess, they contain a combination of two hormones, progestin and estrogen. Now, for the most part, the amount of progestin kind of stays the same across different pills. The real variable here, the thing that changes the dose, is the amount of estrogen. And that specific type of estrogen, it's called ethinyl estradiol. This is the name to remember, because how much of this is in your pill is what separates a high dose from a low dose, or even an ultra-low dose.
So here's how it all breaks down. High-dose pills, they've got 50 micrograms of estrogen. You honestly don't see these much anymore because the side effects can be a lot. Then you have the standard or low-dose pills. This is what most people are on, and they land right in that 20 to 35 microgram sweet spot. And for folks who are super sensitive to hormones, there are even ultra-low-dose options with just 10 to 20 micrograms.
Okay, so this brings up a pretty obvious question, right? Does a bigger dose mean it works better? This is the main trade-off we're going to dig into, and I think the answer is going to surprise you. So let me just make this crystal clear, because it's probably the most important thing you'll hear today. The dosage level does not affect how well the pill prevents pregnancy. A high-dose pill is not more effective than an ultra-low-dose one. When it comes to their main job, they are all equally good. So if it's not the dose, what is the biggest factor in how effective it is? Well, it all comes down to how you take it. This is where we get the idea of perfect use, that means taking your pill at the exact same time every single day, no exceptions, versus typical use, which, is real life. It accounts for maybe forgetting a pill or taking it a few hours late sometimes. And check this out. With perfect use, the numbers are just incredible. No matter the dose, your chance of getting pregnant in a year is a tiny, tiny 0.3%. That's some seriously effective protection. But look at what happens with typical use. That number jumps all the way to 9%. I mean, that is a massive leap. It really just proves that your own habits matter so much more than the amount of estrogen in the pill. Which brings us right back to our big question. If they all work the same, why do we even have different doses to begin with? And the answer is actually pretty simple. It's all about managing side effects and finding what feels best for your body. See, for a lot of people, higher levels of estrogen can bring on some unwanted guests. Things like nausea, breast soreness, or headaches. A lot of the time, just switching to a pill with a lower dose of estrogen can make those things way better, or even make them go away completely. But here's where it gets a little tricky. It's not always as simple as lower is better. Take that really annoying spotting between periods. That's called breakthrough bleeding. In that specific case, a doctor might actually suggest a higher dose of estrogen. It can help stabilize things and get that bleeding under control. So yeah, it's a real balancing act. So let's zoom out for a second, because beyond just preventing pregnancy, these pills come with a whole bunch of other potential benefits and, of course, risks that you really need to think about. The benefits can be pretty amazing. A lot of people use the pill to get shorter, lighter periods, or even skip them altogether. It can be a total game changer for bad PMS, and research shows it's linked to a lower risk of certain cancers, like ovarian and uterine cancer. Plus, it's a go-to treatment for conditions like PCOS. Now, on the flip side, you have the potential downsides. We've already talked about the common stuff, like nausea and breakthrough bleeding. For some people, it can also raise their blood pressure. And the most serious risk, the one to really be aware of, is an increased risk of blood clots. This risk does go up with higher estrogen doses, which is the #1 reason those 50 microgram pills are so rare now. And that risk of blood clots, it brings us to a super important point: safety. Because even though these pills are perfectly safe for most people, they are absolutely not the right choice for everyone. And this is the stuff you have to talk about with your doctor. You should avoid combination pills if you're over 35 and you smoke. That combo is just too risky for your heart. Same goes if you or your family has a history of blood clots, if you get migraines with aura, have uncontrolled high blood pressure, a history of heart disease, or if you had a maybe in the last 3 weeks. Okay, let's bring it all home with our last section, finding your fit. After all this info, the goal isn't for you to make this decision by yourself, but to feel way more empowered to have a really good, informed chat with your doctor. So, what are the next steps? It's pretty simple, really. First, take a good, honest look at any side effects you're having. Are they no big deal, or do they bug you? Second, get crystal clear on your health history and your family's. And third, take all that info to your doctor and just talk about whether a different dose might be a better option for you. Because that's what it all comes down to. There's no single best birth control pill for everyone. The best dose is the one that works for your body and your lifestyle, the one that stops pregnancy while giving you the fewest or the most manageable side effects. It's all about you. So we'll just leave you with this thought. Knowing now that the dose you take doesn't change how well it works, but it could change how you feel day to day, is it maybe time to ask if the pill you're on is truly the best one for you?